Hi, I'm Herb Robinson. I want to describe a tool that you can use to help enhance your workplace directly after viewing this video. It's called a waste walk. As a Master Black Belt and Project Leader, I understand that solving problems can be quite a challenge. Few have been solved in conference rooms. Whether you're in a Kaizen event, a quick changeover activity, or working on a longer-term project, being able to walk through an area that is being reviewed will be critical to your success. Waste is not the best word to use, but inefficiency walk just doesn't seem to flow well. Relative to the environment that you're in, such as healthcare, we need to be careful as the term waste takes on an entirely different meaning. Perhaps you've heard of a safety walk, a group of folks who walk around a facility to look for safety-related issues. Well, a waste walk does the same thing, with the search being specifically for waste or inefficiency issues. Here at Robbins International, we created the acronym HOSPITAL to provide an easy way to recall all 8 different inefficiencies. To recall these inefficiencies, it's best to visualize an example of each. Use examples from your own workplace. I will mention the 8 now, although I will encourage you to watch another video on Lean 8 inefficiencies located in our White Belt program prior to your waste walk. H is for halting or waiting. Consider the huge amount of time that we or our work spend stopped. 20 reports on our desk, yet we only work at one at a time. The other 19 sit idle. Same with our material lots. We wait on lines at sporting events, grocery stores, and at traffic lights. We wait for test results. Patients sit in waiting rooms. Heck, we even call it a waiting room. When was the last time you attended a meeting that actually started on time? More waiting. From a time standpoint, this is probably the largest contributor to waste and inefficiency in the workplace. Your walk should look for people and things halting. Take notes. Next is O, which is for overproducing. How many times do we write information? We repeat items as we copy from one document to another, from a requisition to a purchase order, and then into a computer. We have duplicate systems that require us to keep information in multiple areas. Every time we document information in 2 separate spots, there's an opportunity for an error. Look around at all the extra reports, duplicate forms, and extra work that we produce that uses up our precious resources. S is for slips or defects. Consider the different errors made throughout your processes. Wrong medication or dosage, product that requires rework or perhaps is scrapped. Can we automate or perhaps error-proof tasks so that we don't make mistakes in the workplace? What about simplifying or reducing the variation within our systems to achieve fewer slips? P is for processes that are non-value added. There are a number of processes that we perform that do not add value for our customers. There are 3 important items that would make a process value added. The process needs to satisfy all 3, else it is considered non-value added. First, does it change the product or thing going through the process? Second, is it done right the first time? Third, is the customer willing to pay for it? The customer needs to value the process, else it is non-value added. Now look for steps within the process that are non-value added. I is for inventory. There is a large amount of money tied up with inventory. As you walk around, look for piles of paper and product. Do we truly need all those items in the stockroom? What are the inventory turns at? How many patients are in the process just sitting idle? That's just another form of inventory. Think about the money spent to keep excess inventory on hand. Could that money be better used somewhere else? Excess inventory within different departments will slow a process. T is for transportation. We transport patients all over our medical facilities, through elevators and hallways. Well, think about all this wasted time. We might even consider the flow of a document circulating for approvals. I've seen countless factories with poor layouts that employ extra employees that do nothing else except transport product. A few of these require company vehicles, as there are often miles between buildings and the next department in the process. Think about the travel in steps, miles, and time that this takes. Transportation can be reduced by putting people and departments who work closely with each other next to one another. Look for carts, envelopes, and other items that are used to transport things. Is all this truly necessary? A is for action or motion and is different than transportation. Think of action as your motion, not the patient, product, or thing in the process. You walk to the filing cabinet and need to open 3 drawers before you find what you need. Ever look for a patient's chart? How about searching for a tool that has been misplaced or is simply not stored locally? Look for people walking around to obtain items to complete the task that they are performing. Finally, our last inefficiency, L, for lack of employee engagement. How often are thoughts and ideas from employees ignored? I once heard a manager speaking to an employee, I don't care about your input, I care about your output. Wow, that sent a message. Not the way I want to motivate someone to work with me. Consider asking area personnel about waste and inefficiencies that they see in their areas. No reason not to get ideas to solve problems from these folks at the same time. Now that you know a bit about the different types of waste, I'll describe how to go about performing a waste walk. First, you'll need management approval of the purpose and the scope of the waste walk. Next, inform the department management that you are coming as well as the reason. I recommend a relatively small team of 3 to 5 people. You want others around you, not just your one set of eyes. We all see things differently, and the more diverse the team is, the better. Diversity in all ways possible. New employees versus veterans, guys versus gals, within department versus folks from other departments, and consider team members with different backgrounds. Diversity is the key to success. Gather the required materials, including a checklist. You can download ours for free at www.lean2020.com. Now consider the time needed to perform the walk within your established scope. You won't be able to find all the problems within your company, so just focus on the areas defined in your scope and then go do it. Lastly, compile the results and come up with a plan to reduce or eliminate the efficiencies you've discovered. Consider contacting Robbins International for assistance. We're experts when it comes to assisting companies in different environments. We can help you get lean. When your team is together, go out into the different areas and become detectives. Using our form as a guide, search for signs of the 8 different inefficiencies. Write down all observations and consider using a camera to document what you are seeing. Congratulations completing this training video and learning about the important tool Waste Walk. You should be able to close your eyes and think of the acronym HOSPITAL, which describes the 8 different inefficiencies. Now gather a team, make certain you have our checklist, and go find the waste. Don't forget to celebrate your success. Also, consider our free online business and healthcare white belt programs. You'll learn about Six Sigma, Lean, and process control. Lastly, I encourage you to share our website with others and consider attending one of our other belt programs to improve your understanding of these tools as well as learning other valuable ones. Good luck with your waste walk.